Hi. So it's the end of Dysautonomia Awareness Month, or the second to last day of it, and I've been pretty busy this month and everything, but I did want to do a quick video, like discussion video, and say a few things that maybe I haven't said before or summed up properly before. So I want to start with reading a meme on dysautonomia that I really like, that I've shared a couple times, because it just kind of sums it up and gives a very important fact that I think people need to know. So what is dysautonomia? Dysautonomia is the umbrella term used to describe many different medical conditions, many different ones, okay, that cause a malfunction of the autonomic nervous system. The autonomic nervous system controls all the automatic functions of the body that we do not consciously think about. So heart rate, blood pressure, digestion, dilation of pupils of the eye, kidney function, and temperature control. People living with various forms of dysautonomia have systems, which can result in lightheadedness, fainting, unstable blood pressure, abnormal heart rates, malnutrition, and in severe cases, death. Dysautonomia is not rare. 70 million people have a form of dysautonomia worldwide. Despite dysautonomia's high prevalence, it takes most patients many years to be diagnosed due to lack of awareness in the public and medical professions. So, dysautonomia is something that is being largely ignored by the medical community, but we're getting to a point where that needs to stop because people are suffering, and I know firsthand because I am a person who has suffered, and I don't want to really go on too much about my experience in this video because I just don't feel like getting into that. Sometimes getting into my things that cause me a lot of pain, when I try to, I have a hard time finding the words for that, for them, unless I'm really doing a specific video on it and I'm trying, or I have a hard time spitting out the words in a normal way. Either I can't at all or I'll like ramble on about it. So I'm not going to go on too much about my personal experience other than to say that it's been very painful, very life-limiting, and it's caused me a lot of devastation. And so people with dysautonomia have, as you can, maybe hear from reading that description, a very, very, poor quality of life. They're very life-limited, and the worse the dysautonomia gets, the worse that gets, obviously. But the thing about dysautonomia is that, like the meme said, it is caused by other conditions that are also undiagnosed. And so it's an umbrella presentation, which is caused by damage to the autonomic nervous system that is happening because of other issues that are going on in the body. Several issues, if you look up dysautonomia and educate yourself about it, can cause dysautonomia or even a combination of them. So people with chronic illness often do develop dysautonomia, particularly people with Ehlers-Danlos syndrome, which is what I have. And I think that's just because in Ehlers-Danlos syndrome, the collagen is fragile. The collagen, like the skin and the joints, are fragile and loose and hypermobile, and so is the body. And this sets the body up for all kinds of issues with poor infection healing and spinal cord instability and degeneration and damage, and those and nervous system disorders and autoimmune disorders. All of those problems lead to dysautonomia, lead to the development of dysautonomia. So if those conditions are at large, then the dysautonomia is just going to keep getting worse and worse. And dysautonomia is just something that doctors are intimidated by, so they try to avoid diagnosis of it. They don't want to learn about it. And even when they do learn about it and diagnose it, they often, basically tell the patient that there's not much that can be done, and, here's these drugs. They don't work so well, but they partially work to partially stabilize. I'm on quite a few drugs. I'm on a few drugs for dysautonomia, for my dysautonomia, and it's really done. It's you know, forcibly stabilized me at least part way, a good part way. But, you know, it makes me more tired and weak, and it's starting to irritate my kidneys, which is really worrying me. I don't want to go on about that, but my kidneys are showing some signs of stress from, you know, a few years of being on these treatments, these Band-Aid treatments that just do nothing but really block symptoms. And it doesn't need to be that way. It doesn't need to be that way when there are actual treatments for the causes of dysautonomia. But the problem is that if you're even remotely financially limited, you're at the mercy of, you know, health insurance and socialized health care. You can't pay for the top-notch, few, very specialized specialists that actually do know how to deal with this problem adequately. You're at the mercy of the rest of them who are not caught up and, you know, are ignorant mostly about this. And, you know, in that you're stuck, you know, not getting the proper care to a detrimental point where, you know, the longer that one goes without dysautonomia being dealt with, the worse that it's going to get, and the harder it's going to be to reverse it. Because, you know, dysautonomia can be caused by, you know, infection, chronic infection, autoimmune disorder, which affects the endocrine system and, you know, affects the balance of the thyroid and the adrenal glands, the pituitary, and the brain itself. And the kind of tests that really, like, show what, you know, can catch those kinds of disorders, those kinds of functional disorders that are happening, they're, you know, with the immune stuff, it's very intricate, you know, cellular level testing, and with the endocrine stuff and the neurological stuff, it's functional testing, so like a functional MRI that measures the brain activity, you know, in action, and, you know, stuff like a thyroid stim test where they stimulate the thyroid and then measure the, you know, the levels over a period of a few hours. The same with the adrenals and the pituitary. Like, those tests are done in hospital, and they're obviously much more costly to order and to do than, you know, something like a simple blood test. But the problem with the simple blood tests is that they suck. They're cheap and they suck. And they suck for these kind of functional disorders because levels, you know, of, you know, hormone levels and whatever, they go up and down. You know, the body is fighting to keep its normalcy, and it's going to be succeeding at least half the time. And then it's going to be going maybe too high or too low, like all of a sudden when the threshold breaks and it can't keep that normalcy anymore because it's fighting disease. It's fighting a disease of that organ that's supposed to keep it normal, like the thyroid, like the adrenals, like the brain, nervous system, whatever. And so, you know, it's kind of like rolling a dice when you go and take a blood test, you know, at a standstill moment. You know, often a person has to be in the throes of a severe flare or an attack for that to really show. And so, and so doctors don't want to, like, pay more. And often their, you know, their bosses, the people above them, won't allow them to order the more expensive tests. They have strict rules on them, you know, imposed upon them, that they can, you know, get in trouble unless they have something to, you know, unless they have a way to answer for why they've ordered that. And they normally only resort to ordering that when the person is extremely ill, and it's very, very crucial that they find out, you know, what is going on. And even then, some doctors, you know, it doesn't occur to them that that's what they need to do. They don't, in that case, know enough about dysautonomia and the causes behind it. They're ignorant. So ignorance, or, you know, or fear of, you know, losing money, you know, being restricted by protocols, all those barriers stand in the way of somebody with dysautonomia being able to get proper care. And rather, they get neglected and, you know, go down in a downward spiral. And we're talking about people that are, like, young oftentimes, that have, I'm not you know, trying to discriminate. I mean, everyone of every age is entitled to care. And I'm just saying, you know, dysautonomia is robbing the life quality of people like that could be at the height of building their career. You know, it could be like getting married and having kids if they want to, or traveling, you know, and it's just it's so brutal. I'm trying not to get emotional. See, I just I just detached. I have a really bad habit of like choking back the tears. It's an awful disorder. You can't just go to a movie. You can't just go out to dinner. You miss out on so much. It's like you're a prisoner of dysautonomia for the most part. And then even with the meds, they only partially work and they make you tired and sick. So, I mean, it's just not a solution, and it isn't fair that only the more wealthy people can access hope for, you know, hopeful treatment for dysautonomia. You know, the other problem is that there is a lack of research, you know, and like, because not enough people are talking about this. Not enough people are, you know, like 70 million people are suffering with dysautonomia. So why is it so like obscured when so many people are suffering with it? It needs to be spoken about. People need to get loud about it. Concerns need to be raised so that, you know, awareness is raised, and then, you know, there will be things like Run for the Cure and like, you know, like grassroots movements to get, you know, funds raised for research so that we can, you know, discover through research more cost-effective ways of testing for the underlying issues that cause dysautonomia, and more effective treatments for those issues. Because, you know, the truth is that it isn't a simple condition to treat. Like, it is, dysautonomia is damage to the autonomic nervous system by various deeply embedded factors in terms of the way that one system is functioning. And those things need to be both medically treated and rehabilitated, or a combination of both. Like, someone might need spinal surgery, you know, if they have Ehlers-Danlos, because it's very common to have like dysautonomia because of spinal issues when you have Ehlers-Danlos. But with Ehlers-Danlos syndrome, that's not the only reason for dysautonomia. Often people with dysautonomia have more than one cause to it, you know, and that's what makes it so complicated. I don't know if I've covered everything that I want to cover, but I want to stay under 15 minutes. So I'm going to write a blog about this, I think, that will be a little bit more coherent, because I'm a little bit better in type than I am in speech. In fact, I'm much better in type than I am in speech. And it's frustrating, but it is what it is right now. And so, yeah, so I hope that I've made some sense here. Basically, dysautonomia especially affects people with Ehlers-Danlos syndrome and Lyme disease, and, you know, other like umbrella autoimmune and connective tissue and disorders and infections that, you know, cause damage to the autonomic nervous system. But, you know, people with those umbrella labels have several complications that may be contributing to the dysautonomia. So the management of dysautonomia, and even reversal of some of it, or rehabilitation of some of it, lies in finding out what the culprits are. Not easy to do, expensive, time-consuming. And so what happens? The doctors that are only allowed to order these crappy, cheaper tests, you know, if these things don't turn up, and, you know, they basically go into a denial mode and say to the patient, like, this was negative, you're fine, like, there's no, you know, you stop investigating it, like, just accept that you have this thing for whatever reason, you just accept this, accept that your life is going to suck forever, and that meds can only, like, just barely control it while they're making you tired and vegetable-like, and you shut up and take these, and if you have a problem with that, then you get to see psychiatry. And then psychiatry comes in and is used as a weapon to shut that person up so that they stop, like, asking why. And that happens a lot when people are financially limited by a socialized healthcare system or low-tier insurance, where a psychiatrist sort of comes in, is used as a weapon to you know, diagnose a person as partially somatic, or, you know, like anxiety, phobia. Like they use, they diagnose some kind of psychiatric disorder that can at least partially, you know, what do you call it, discredit that person. And therefore, you know, it's violent. Like, it's a violent, ugly thing to do, and it's angering, and it happens all the time. It's starting to get a little old. I mean, people are starting to talk about how it's not okay for psychiatrists to just be used as weapons against people that are chronically ill. You know, it is so extremely wrong, and it is starting to get spoken about a bit more, which is good. But they're still being used for this purpose, and it's ridiculous. I mean, the last DSM, you know, they went and totally elaborated on the somatoform types, and they invented a new one where somebody has an illness, but they think it's worse than it is, or they're basically pathologized for wanting to know the reasons behind the illness and why and whatnot. And this is apparently a disorder called somatic symptom disorder, where it's like, oh, the person is ill. Like, I could literally, like, read out the description of it and, like, darkly make fun of the whole thing, because it sounds so stupid, and it sounds like it was created as a tool to discredit patients who want to know the truth, you know, the reasons behind why they're sick and what they could possibly do about it if they had the money and the means to do it. And but if people start to talk more, and awareness is you know, raised, then the demand for research will go up, research will happen, and we could find those better ways, those more cost-effective ways to deal with this. And then there won't be this big discrepancy where it's either like inaccessible and you can just kiss your life goodbye and rot in hell, or you get the top-notch treatment and it's all like shh, you know, nobody knows that you got cured of your major illness because you had the top-notch ability to do it. You know, I see that happen in wealthy people. They have the means and they get the top-notch care, and it's very successful for them. And it hurts, of course. You know, I'm not going to lie that I don't feel angry and jealous and desperate, and, you know, I don't feel like there's a spear in my heart when I see people being able to have those kind of opportunities, because, like, I want life, you know, I'm a larger-than-life person, and it's so painful to be so life-limited. So anyway, I'm completely rambling now, and I've gone over my time of 15 minutes, just great. Trying. But anyway, those are a few things about dysautonomia. Anything that I didn't cover, I'll try and cover it in a succinct blog, and I'll attach that link. So that is what I have to offer for this year's Dysautonomia Awareness Month. I didn't go too much into my own personal experience because it's hard, and I thought I would just stick to some of the things that I've been thinking about in terms of this subject most recently. And please, if you don't know what dysautonomia is, please look it up and learn about it and pass it on. Thank you.